All right, we'll get started. Welcome, everyone, to our April CHEI Data and Action webinar. As we get started, if you would just take a minute to share in the chat your name, organization, and pronouns so we know who's here with us today. I am McKean Scharf. I am a CHEI epidemiologist here at the Massachusetts Department of Public Health. I'm joined by my colleague Isabella Fuentes, who's a community engagement specialist. And we also have with us our regional data and action support providers from PHI, Public Health Institute of Western Mass, and MAPC. So we have Kathleen and Rebecca and Tanaya. Barry, I don't know if Barry has joined yet, but so we're all here to share with you about using data for grant applications and seeking funding. After we have presentations, we're going to have a couple of breakouts, and we want to put folks in breakouts by communities that you work with or topics you focus on. So if you would take a minute and click on the Mentimeter that is in the chat. Rebecca Hunt just shared it. And let us know which group you'd like to join for breakout. So I know you may work on multiple topics or with multiple communities, but whatever you're thinking about in terms of using data for funding, if you click on the Mentimeter and select which one, and then we'll divide people into breakouts later by topic or community.
And a quick note that this was something that was recommended in a previous evaluation survey, and we wanted to implement it to make sure that we're being responsive to what folks are looking for out of these meetings. And that if there's anything that you want to see out of these meetings, feel free to put it in our evaluation survey at the end of this meeting, and we'll try to implement it for the next one.
Thanks, Isabella. All right. Well, if you haven't had a chance, please go ahead and click the link and indicate your community or topic. But we'll move on to our agenda for today. So we will start with an overview of the Community Health Equity Survey and Data to Action Framework. We'll have a couple of presenters talk about funding and data, including sharing stories of using CHES to obtain funding. And then, as I mentioned, we'll have time for breakout discussion to reflect on how you can use CHES or other data in your efforts to obtain funding. And then we will wrap up and make sure you all know how to request data if you'd like to. And we'll ask you to fill out a sorry, I'm just making sure there wasn't anything in the chat. Sorry. A feedback form. And as Isabella said, we really do use that feedback to try and guide future workshops. So just a quick overview of our survey, the Community Health Equity Survey. Oh, do you want?
Sorry, I moved too quickly.
That's okay. So the Community Health Equity Survey was a survey that we had out in the fall of 2023 to collect data on root causes of health and health inequities in Massachusetts. It was open to Massachusetts residents 14 and older, and we that data is available, so you can access it either through our dashboard on our website, or you can submit a data request and we'll have more information about that. But really want to make sure that all of our partners that helped collect all of the data have access to the data and are able to use it for whatever they need, including trying to get funding. And then this is something we presented on before, but this is our data and action framework. The Public Health Institute of Western Mass helped design this. So just thinking about this as data and action as sort of a cyclical process. We have gears here to sort of illustrate that. Um, so you want to define sort of how you want to use data for action, analyze and interpret the data, then prioritize based on that analysis, act on it, and evaluate. And in the center of this is equity, voice, and power sharing. So really making sure that we're centering those things as we do data and action work. And then the goal is moving towards positive change. Oh, so here's more about CHEI. Sorry, we're jumping around. So this is the model that we use for CHEI, and our goal is to promote the health of Massachusetts residents and reduce health inequities through a health equity data and response system. So I already shared some about our CHES survey. One of our pillars is also data in action, so what we're doing now. And then community engagement practice is our other pillar. So we've had community engagement throughout the process of both developing, implementing, and now analyzing data. So I think I talked about this before, but just a little bit more about our health equity data system, which is comprised of both our health equity survey and also some community evaluators that we work with to collect qualitative data. We have an equity focus and collect data along the health inequity pathway, including root causes. We center community, and we have communities of focus that are often underrepresented in public health data. And we're focused on actionability and timeliness, so gathering data on current public health priority areas to identify need and opportunities for public health action. As I mentioned, we have a number of communities of focus who are often underrepresented in data systems and also most impacted by health inequities. They are listed here. And these are the survey topics that we covered in our 2023 survey, ranging from demographics, uh, looking at a number of drivers of health, as well as health outcomes. All right, I'm going to pass it off to our colleagues to introduce our next speaker. Thanks.
Thanks, McCain. And for those who aren't familiar or are new to CHEI, all of this information can be found on the DPH website, and we'll have the link at the end as well. So now we're going to move into hearing from a couple speakers, and they're going to speak about CHES data and data in general and using that to obtain funding. I'm Kathleen Zegda. I'm with the Public Health Institute of Western Massachusetts, and I'm really happy to see so many people here today. I know this is something that's on a lot of people's minds right now. So first, we're going to hear from Philip Gonzalez. He's the president and CEO from Metro West Health Foundation, and really appreciative for you to be here today, Philip. And then we're going to hear from Lee Drewitz, and he is from the United Way Pioneer Valley. And Lee is going to share an example of how they've used data to obtain funding, CAGS data. So now I'm going to turn it over to Philip to speak a little bit about funding and data.
Thank you, Kathleen, and good morning, everyone. It's great to be with you all. It's wonderful to see some familiar names and faces. I'm in Framingham, Massachusetts, and the Metro West Health Foundation serves 25 communities in the Metro West region. We provide grants, scholarships, we run a leadership program, and we are an active partner with dozens, if not hundreds, of nonprofits in the region, trying to make this region a healthier place for all of its residents. I was asked today to speak a little bit about funders, our use of data, and the way data often kind of plays a part in our grant-making process. So I'm going to try to give you a perspective, not just from my foundation, but I've been a funder in Massachusetts for 25 years, working at a variety of different health foundations. So we'll try to weave in some of what I know my peers do and my colleagues do in order to make this as relevant as possible for all of you. I want to start off by saying thank you for all the work that you do in community. These times are difficult, and there's a great underappreciation of the work of all of your organizations and what you do for all of us every day to make our communities safer, stronger, and healthier. So just thank you for everything you're doing, and I just want to acknowledge that we're all in this together. So as a funder, and I can generalize a little bit here, funders tend to really rely heavily on data. We think of data as a very important asset in community. It's a guide for us in our work, and we think it should be a guide for all of us as we try to come up with solutions to the problems that our communities face. And just to give you some examples of the way funders support and invest in data. And by the way, I should say, I was a big supporter of the Community Health Equity Survey when it came out in 2023. And in my role then at a different foundation was actively promoting it with all of our grantees and partners to make sure that folks in community would respond and participate and get the data and the sample to be as large as possible. But my individual foundations have also invested in data. In my last role at the Point 32 Health Foundation, we were investing in the Healthy Aging Data Reports, which serve most of the New England states. Just to let you know that that foundation continues to do that work, and on May 1st, a new data set for Healthy Aging Data Reports will be available for 5 Massachusetts states. And if you want to find out more, you can go to healthyagingdatareports.org. So May 1st is the release date for that. My current foundation, we serve Metro West, and we are an integral partner in the development of our community health assessment every 3 years. We also field, through the use of educational development consultants, a kind of an analog to the behavioral youth risk factor surveillance survey. So all of the districts in our region have a slightly more enhanced data set around adolescent health, and that's fielded with every middle and high school in our 25 community region. And then we've also recently released and developed on our own something called the Health Equity Timeline, which tries to put data, times, and places and ideas in a continuum around health equity. And if folks are interested in taking a look at that, it's available on the health equity page of our website, and I've just put the link in the chat. So as a funder, we feel important that the data be available and accessible. We don't think of it just as something that we want for ourselves. We think really of nonprofit organizations as a key audience for all of the data that we make available. I have a research director who has office hours every week, so any nonprofit in our region can ask for some time to mull over the data that they're working with, that they're looking for, that they're trying to kind of build a story or a narrative around. Again, we think of data as an important asset, not just in the relationships that we have one-on-one with nonprofits, but we know that it's an advantage that nonprofits can have when they're seeking engagement and support from other sources of support, whether it's foundations, individual donors, or other entities. So, and the thing with funders is that we have multiple audiences always. So while nonprofits, I would say, are a very core audience for us, you'll see others really also focusing on policymakers and decision makers. So I'll cite, for example, the Blue Cross Blue Shield of Massachusetts Foundation, which has very robust data infrastructure. They house the Mass Medicaid Policy Institute, which puts out regular reports, and they also engage with some very high-level consultants to analyze things like health equity issues, and they're doing ongoing analysis of the potential Medicaid cuts that are being discussed at the federal level. So you can continue to look to organizations like that for more up-to-date information as it becomes available. Again, sometimes those things might be oriented to the decision makers working in Boston on Beacon Hill or at the municipal level. But the reality is that that foundation, like ours, thinks of nonprofits as a core audience, and they will do what they can to make the information that they're putting out there accessible and understandable and actionable. So I want to talk a little bit about the how data shows up in grant making in particular. Happy to talk about other things if there are further questions, but the task put to me was, hey, you're a funder, can you kind of give us a glimpse behind the curtain about how funders think about data and what we look for? And I'm happy to do that. Again, I'll try to generalize as much as possible because not all of you are in our region and able to engage with us directly. But you can take what I'm saying and apply it to many other funders that might be serving Massachusetts communities. So I'd say that there's three major ways that data shows up when we're looking at grants and thinking about grant making. The first is to define the population and the need. And in specific regard to a proposal, most of the proposal formats that you'll see from funders will ask, for a definition of what you're trying to accomplish and who you'll be serving. And they will look for data that gives them a sense that you have understood the issues in community beyond just what you're seeing in your direct day-to-day services, that you understand the data that's available in the larger world so that you're making access of things like the Community Health Equity Survey data, other data that might be available in a public setting, so that they have some sense that you can evaluate what you're seeing and what is out there for information and figure out where you best fit in addressing needs. The second area that we look for is data informing the course of action that you're choosing to take. So oftentimes, if you're thinking about a direct intervention or a program, funders will wonder, how did you land on that particular model? Why is that the model that fits your organization, your community, and the needs you're trying to address? And so there, it might be more specific information regarding where that model's been used, where it's shown to be effective, if there is data support for that particular intervention or model. The ability to reflect on that a little bit in a proposal is helpful for the funder to understand that you've done some critical thinking and analysis about what you're trying to accomplish, what's going to give you the greatest advantage, but also what's going to fit. What is the right model for the people that you're serving, for the organization and the way you're operating, and the capacity that you've developed over time. And then the third area is a sense of how you might measure your progress. And so oftentimes funders will have a section of the proposal labeled evaluation, and I want to talk about that a little bit more in a minute. But we will look for some sense of how you're going to look at what you're doing, to learn from it, to adjust as necessary, and at the end of the day, to be able to tell some level of story about what you set out to accomplish and what you were able to learn and accomplish through that work. So again, here, the data may be as simple as you tracking who's participating, the number of people that are showing up for events, gatherings, sessions, the outreach that you're doing, and the number of people that you can expect to reach through the outreach that you're undertaking, the number of partners that you're attracting, or the number of conversations you may be having about the intervention or the program that you're undertaking as you try to share what you're doing with others around you, whether they be partners, other funders, elected officials and decision makers, whatever it might be. But that's another critical piece. So, and back to that gears metaphor that you saw earlier on the slides, funders often think about this as kind of a virtuous cycle where you are looking at the needs in your community and adding to your first person experience with the serving individuals in your community to understand, so what are the other needs and how is this happening in a larger context, to then thinking about what's the right approach to address those needs, and then talking about how you're going to measure your progress, in part at least, so that you can adapt what you're doing to make sure that it's being as effective as you want it to be. Now, those are the things that we often see and discuss with individuals that are seeking to submit a proposal. Like many funders, we have a multiple stage application process, which gives us the opportunity to circle back with some early feedback. And we can elevate with folks that we've seen a concept paper from and say, hey, you know, my reviewers are going to ask about X, Y, or Z. So it would be helpful if you could cite some additional information about the model you've chosen or about why this is the priority that you think is the optimal use of your energy and efforts at this moment in time. And so you're not expected to get it all right. You're not expected to have PhD level analysis of which data sets to use and how to move forward. What we're looking for typically is for you to take the expertise that you already possess, the fact that you're in these communities, the fact that you're serving individuals on a day-to-day basis, and say, okay, based on that, plus what's out there for additional data, here's what the most advisable use of resources looks like and the best course of action. So as you look ahead and as you think about this, just want to make a couple of points. First is the importance of local data. You know, it's wonderful that we have data sets like the Community Health Equity Survey, the Healthy Aging Data Reports, and others available in Massachusetts. And as the federal data becomes less reliable, I'll say, hopefully that's an appropriate and charitable term, I think this local leadership around data production is going to be even more important in the coming years. So know that there is great data work happening in Massachusetts. Funders are often involved in it, and they want to know that it's being appreciated and utilized in communities. So avail yourselves of the data that's out there. And if you need help, I know that there are places like the folks hosting the webinar today that can help you understand what's out there. I want to come back to the point of funders and evaluation. I would say that funders, especially the ones that I'm in close contact with, are revisiting that term of evaluation. It's been a scary word for a long time. And lots of folks just automatically assume that what a funder means is, oh, I need to have some science-oriented person to have some rigorous approach to thinking and looking at what we're doing and giving us this cold, calculated decision of is it effective or not effective. More and more funders just want to know, how are you going to measure your progress? You know, at the end of the day, what are you going to look at to tell you whether enough people came, whether you reached enough people, whether people responded the way you wanted, and what that tells you about what to do next. So think about evaluation as a function of what you're already doing, as opposed to some bolt-on extra piece that you add to the work to meet some funders' interest and curiosity. And then finally, just want to leave you with the fact that data without stories is never as effective as the two combined. You are the leaders in your community. Please lead with both your head and your heart. So combine stories with data. It brings the data to life. It helps bring others into the world that you are expert in. And it really is effective, even with decision makers and policymakers, to make them understand the gravity of the work that you're doing and the issues you're trying to solve for. So I'm going to stop there and just thank you for the time and happy to take questions when we get to that point of the agenda.
Thank you so much, Philip. I think you touched on many different things that I think are really helpful for people to think about and how they're using data. And then also thinking about the Community Health Equity Survey and ways that that can complement data that's existing in communities and even some of the more local level data. Now I'm going to invite Lee to speak and share your example of using CHES data and data for funding.
Yep. Thank you so much. Thank you everybody for being here. Thank you to the hosts for hosting this webinar. Thank you, Philip, for sharing your point of view as a funder. So my name is Lee Druritz. I work at the United Way of Pioneer Valley. Like so many United Ways, our mission is to meet the basic needs of our community members through mobilizing community resources. As I'm sure most of you know, most United Ways primarily do this actually through funding, but our United Way is a little bit different. So around 2020, we ran our community survey, and the determination of this community survey was actually that for the Pioneer Valley, which for our United Way is defined as Hampden County, South Hadley, and Granby, out in Western Massachusetts, the best areas of impact we could be working with are really around direct services, specifically food security and financial wellness. As such, we now operate 3 food pantries, one in Springfield, Massachusetts, one in Holyoke, Massachusetts, one in Chicopee, Massachusetts, We also run financial wellness and literacy programming throughout our catchment area. Again, primarily Hampden County, but also South Island and Granby. That involves one-on-one coaching, workshops, and support for different agency partners. Throughout this time, as we've shifted our programming model from a funder to a direct service provider, we've also seen and funding models work for our United Way. So traditionally, most United Ways were funded through workplace campaigns, and those workplace campaigns worked through going out to workplaces, asking for money, and providing money for grants and funding for the work we're doing throughout our catchment area. We still run these campaigns, but that is an increasingly smaller pot of money that we're working with. So primarily now our focus long-term is looking at other fundraising strategies, and this includes foundations, legacy donations, major donors, the typical things that so many other nonprofit agencies are looking at as a long-term strategy for fundraising and for program viability. And what has come with this shift in programming and donations is also a shift in the way we ask for money and the way we have to present our story. Because when you're working on a workplace campaign, it's a very different ask that you're making. Primarily, these workplace campaigns are going out and talking with people who are working in warehouses. Primarily, our donations are coming from entry-level employees. And the story we're making to those donors tends to focus around the story of the people we're working with. And those donors very often come from the communities we're serving. So, the story we're telling often very much reflects a story that people in those workplace campaigns are very familiar with, communities that they're very familiar with, a journey that they're familiar with. With a lot of foundations, especially in Western Massachusetts, the money is not the pool of money we're looking at. That are not as familiar with the stories of the communities we're working with, that are not as familiar with Western. Like the CHEI survey is so fundamentally important to the story we're telling. Take some aggregate data and that we're telling on a local level, specifically around our Western Central Massachusetts, Hampden County. Now, depending on what the survey data looks like, we do have to update that, based on our ability, to get response rates. I'm able to do that. For example, American Community Survey, great data there, but oftentimes the data pool that they're working with is much smaller for the local Western Mass area. And that becomes a fundamentally important piece of the story because, as Philip was talking about, many of our funders are willing to let us focus on the outcomes that we see as important. They let us, strategize and logically work out what it is we're working with, who it is we're working with, what are the important issues, what are the important tasks we need to accomplish to see that journey progress. But they do want to also see data that supplements that proves that we are logically thinking about this, not just based on, the feelings that we have, but a fundamental understanding of these communities and proof that we have that fundamental understanding of these communities. So what we were able to do with CHEI data is really take it, identify important data points for Western Mass that reflects the story and the journey that we're seeing. Take those data points. Like I said, we work a lot on food security and financial wellness. So there's some great data in this data set that talks about how people are having trouble paying for basic needs, how people are having trouble paying for food, healthcare, and their ability to network. And because of our work and its focus on the workplace, we were really able to show that the differences in people who are working and not working, and the differences in income structures really do reflect a serious need in the areas we're working in, and do reflect that the outcomes, the logic model we're working with is based on data, is based on hard facts. And when you can tie that together, it really does present a funding story that is much stronger. And we've heard that from many funders that they really do appreciate and like that ability, that you have those personal connections, that you can tell that story because many funders do understand that this is about personal stories, personal journeys, especially if you're doing financial coaching. That is a one-on-one relationship. And that individual you're working with has a very specific journey that they're working on, a very specific outcome they want to achieve. But at the same time, those things they're working on are connected to a larger story, a larger system. And so our ability to bring the two together has really been fundamentally important for how we can start putting these grant applications together and start asking for money, especially as an organization that, even though we've been around for 100 years, this is a fairly new approach we're taking as United Way, because it isn't the funding model we've used in the past, and it isn't the service model we've used in the past. So it's a new relationship we're building with a lot of foundations, legacy donors, and individuals that we may have had for a long time, but we've never, made an ask like we're making now. So thank you for your time. Thank you for that. I will leave definitely some time for some Q&A, because I want to make sure people are able to ask the questions they want to ask.
Yeah, thank you so much for sharing that example, Lee, and hearing again the importance of combining data and experiences to be able to tell the story. So now we'll open it up for Q&A if people have questions for Philip or Lee. You can either drop it in the chat or go ahead and ask your question. So I'm not seeing any questions right now. I think really appreciated hearing the overview and then also the specific example. Oh, we have one question in the chat now. So Philip, you had spoken to evaluation and really shifting what evaluation looks like, or is like what is considered important by funders. And so the question is qualitative reporting good enough?
Thank you for the question. And I'd say the answer really depends on the work that you're trying to help others understand. There are places where qualitative is essential and maybe more important than the quantitative, but it is hard to tell a story if you're not giving the contextual picture that the qualitative data is coming from. So at a minimum, how many people did you talk to in order to develop the qualitative kind of roster of information that you're sharing from? Over what time frame did you do that? These are not things that are necessarily hard or require a lot of technology to track, but they do help in particular the reader of a proposal to understand, here's the work that we did over this period of time, and here's data showing us that we've made a positive difference.
Thank you, Philip. Any other questions before we move into breakouts? Okay. Well, we really appreciate you taking the time, Philip and Lee, to share with the group here today. And so now I'm going to turn it over to my colleague, Barry at MAPC, to set us up for breakouts.
Thanks, Kathleen. Morning, everybody. And thanks again, Philip. Thank you again, Lee, for sharing your stories. I think what we found so powerful in these sessions is the ability for us to kind of share across work we do with either kind of peers or folks who are trying to say about similar changes that we do in our work too. And so the point of the breakouts now is really to be able to share your personal experience, your personal perspective, but also the questions you may have with folks who might be in kind of similar situations. So kind of through that collective knowledge building and sharing, we really kind of set up folks to be in a good position to do this kind of work, of whether it is making the case for resources, implementing in a kind of data or evidence-driven way, but also to that last point, reporting back kind of the impact of the work that we're having too. So I'm probably going to check with Rebecca, maybe some others. I think in the background, we've been setting up breakout groups that would be along the different kind of Mentimeter responses to thank you, Rebecca. But like we said, we're going to kind of look to put you, and to Isabella's point earlier, put you in groups essentially where essentially kind of you had that affinity or that interest of bringing you here today around data too. So I would say get ready. And I think shortly you'll see your breakout request pop up. We'll be there for about, I think, 10 minutes. So looking at the clock, it's about 11:40 where I am. So we'll be there for about 10 minutes to kind of talk and share. And then we'll come back for about 5 minutes and have a chance again, if you want to kind of popcorn or share anything that you took away or felt important to talk about within a large group before we talk about next steps.
A quick note that if you are using ASL interpretation and would like an interpreter in your breakout room, can you please put that in the chat or raise your hand with the Zoom hand raise feature now?
Thanks,
you.
Isabella. Yeah, thank you.
And I'm going to go ahead and open up the breakout rooms. They are by topic, and you can pick based on which topic you or community of focus you are focused on in your work. So should be open now. Can somebody let me know, are you able to, okay. Are you able to join the rooms?
I don't have anything up just yet, Isabel.
I didn't see anything either.
Oh no.
If you look at the bottom right-hand corner, it might say join breakout group. And if you click on that, you should get all the options.
Thank you. And want to elevate that Lydia also put in the chat. You need to click more. That, yeah, the bottom 3 dots with more and then breakout rooms. And feel free to put in the chat or message me or come off mute if you're having challenges with this still. Folks on the CHEI team, I'm going to go ahead and assign you to some breakout rooms. Have that. Oh. Perfect. Goodness, I'm sorry. I'm messing with the Zoom permissions. On my end, I have that Tanaya is going to be wrapping us up. Tanaya, is that correct?
That's right.
Perfect. Let me just get you spotlighted. Fabulous.
Awesome. I'll quickly share what was shared in my breakout group because I think it's something that everyone feels joining these workshops, that it's a great place to understand resources and network, even if you don't have clear ideas of what you want to do with the data. So just sharing my appreciation. And before I wrap us up, I wanted to say that thank you, Philip and Lee, again for sharing your insights and your suggestions. And I'm going to drop in the chat an office hours interest form. So if you're looking to join a smaller group or having one-on-one conversations about the data, do fill that form and let us know, and we'll get in touch with you. And there's also a feedback form. We love to hear your suggestions and how your experience has been. So do fill that form. It will take less than a minute. And then stay tuned for the next steps and be on the lookout for Isabella's email.
And there were questions, so I've put the last couple slides up and about where to access the data. And the information about how to get regional data and action support and where the data tables are and where the spotlights are. So thank you, Rebecca, for dropping it in the chat. There's a lot of information on the website, on DPH's website. And you can learn more about CHES and the data tables and then request the customized data. And as we mentioned, office hours with the interest form and then also monthly additional webinars. Oops, apologies. And then please also, we invite your feedback. As Isabella was saying early on, we really want to make sure that these are meeting your needs and your interests. So I will turn it over to Isabella and McCain if there's anything that you all would like to share. Really appreciate people taking their time to be here today. We hope that the information was helpful as you're thinking about, one, recognizing some of the room are learning about CHEI and CHES data. So hopefully it helped to understand what's available and where to access resources, but also as you're thinking about using CHES data, and thinking about funding and obtaining funding and different ways it can help you to tell your story, both identifying areas to focus your efforts, so the needs, what the activities you might do to address those needs, and then to understand if it's working. And then what are the stories and the ways combining data, including CHES data, because again, it helps to provide data that isn't necessarily available, quantitative data sets for different populations and in different geographic areas and different topics. So I'll turn it over to Isabella and McCain.
Not much else from me. Just want to echo what everyone has said so far. It is such a joy to come together with all of you and be able to hear your, unique stories of how you're using the data and the work that you're doing in community. So from DPH, we want to thank you so much for being here and reiterate what everyone else said, that CHEI as a whole and these workshops in specifically are intended to serve you and provide you with information that you can use. So again, if there's anything about the survey, the initiative, the whole process, or as specific to a different way that you'd like us to do breakouts or Q&A or anything like that, please feel free to fill out that workshop form or just email us. And if there's anything else that we can do to make sure that we are helping you meet your needs as you are helping your communities meet their needs. So that's all from me. Thank you so, so much. And I hope you have a wonderful day.
Thank you.